In the past, and this message is very important in the Battlefords, in the past, we had a government in this province that would not set goals in healthcare. The Minister of Health happened to be the MLA for this area, and he was asked by the then health critic for the Saskatchewan Party for at least a goal to set in terms of the need of nurses in this province. Sun was saying we were 1,000 short. That's the Saskatchewan Union of Nurses. We believe that to be a roughly accurate number. We were raising questions in the legislature, and when asked for at least a goal, if you're not going to commit to that full number, we asked Mr. Taylor, set a goal for your government. He said, and I'm not paraphrasing here in a way that's not reasonable or generous. He basically said their government was not going to set goals for the recruitment of nurses because when you set goals, you generally fall short of them. That's basically what was said in the legislature. We have taken a different approach. We've set goals in terms of the amount of healthcare professionals we want and the kind of healthcare we need in the province. We set a goal of 800 nurses, actually, that we would have 800 new nurses in the province of Saskatchewan at the end of our term. We didn't keep that promise because today there are 900 more nurses working in the province of Saskatchewan. We exceeded that commitment. We promised to increase the number of doctors practicing in Saskatchewan. There are 200 more doctors practicing today, approximately 200 more doctors practicing today than when we formed the government 4 years ago, with admittedly more work needed in this regard. We promised to create 40 new physician undergraduate seats and 60 new residency positions. We kept that promise. We promised 300 new nurse training seats. We kept that promise. We met that target. We promised to improve cancer care in the province, and today we've increased funding to the Cancer Agency by 55% in 4 years, $43 million. We promised to fully fund the Children's Hospital. And last year, in partnership with the Saskatoon Health Region and the Children's Hospital Foundation, we were proud to fulfill that $200 million commitment. And this past August, we announced the replacement of the Saskatchewan Hospital here in North Battleford. $8 million for planning and a new facility for 188 patients. And in response to our Patient First review, we promised patients and their families that we would work to address the long-standing issue of surgical wait times. Under the NDP, we were experiencing among the longest surgical wait times in all of Canada. And we took a different approach. We added some resources to the ministry. We made an investment, but we also said we were going to utilize private clinics within the public system and also to better utilize the rest of the public system, parts of it that were underutilized. The NDP opposed it then, and they oppose this still. Remember, our plan here does not allow anyone to jump ahead of the line, in line ahead of anyone else. They can't put down a credit card and queue jump. It's still very much part of the public system, but we've deployed private clinics to help deal with the surgical wait list in the province, and the results are in. Those waiting longer than 18 months for surgery in Saskatchewan is down over 70%. Those waiting longer than a year is down over 50%. And in each category of wait time, we are seeing progress being made. And you know what? The people of the province are telling us anecdotally they appreciate the fact that they're meeting with their specialists, and their specialists are saying, we're going to see you in 3 months for your surgery, because it hasn't happened before. And it also, I think, underscores the fact that the people of this province, given a choice between ideology from the NDP and surgeries from the Saskatchewan Party, they'd rather have the surgeries. And we're going to continue to provide that kind of care right across the province of Saskatchewan.